Greetings again, everyone. My name is Dr. Brandy Hare, and again, I am the chair of the Women's Health Symposium. Tonight, we are all here for an awesome webinar during this Women's Health Month. And the webinar will be discussing wellness by design with our speaker, Dr. Emma Guzman. For tonight, we will have an awesome lecture and also a Q&A portion that we would love for you all to engage with. Dr. Guzman, can we have next slide? Now, before we get started, we do have our president of the NDA in the room, Dr. Bellamy, and we would like to get a few words from Dr. Bellamy and also get some information about the upcoming NDA convention.
Good evening, everybody. This is Wallace Bellamy, president of the NDA. I'm not going to take too much of your time. You've got a dynamic speaker and a dynamic Women's Health Symposium coming up for the National Convention in Richmond, Virginia on July 16th through the 19th. I want to see everybody there. It's going to be really impactful, especially during these particular times. Our theme this year is Architects of Change, never shaken, never stirred. And that goes with the times that we're living in and the where we need to actually build for our future. And we've got a dynamic future speaker who's happening right now, Dr. Emma Guzman. I'm going to let her take over right now. And thank you, Dr. Hare, for allowing me to speak.
Yeah. Thank you, Dr. Bellamy, and thank you for all of the time and efforts that you've been pouring into your presidency and into the NDA. We're ready for next slide. And I noticed that we also have our immediate past president, Dr. Baptiste Hill, in the room. So greetings to you as well. Again, my name is Dr. Brandy Hare. I'm the chair of the Women's Health Symposium, but I do also have an amazing co-chair, Dr. Latidra Collins, who is in the room. And on behalf of our Women's Health Symposium Committee, I do welcome all of you to tonight's event, our webinar. For this year, we actually have a huge lineup of events. Currently, we have coming up at the NDA convention our annual awards luncheon. And how many of you have already gotten your tickets for the awards luncheon? Let's see who all can hop into the chat. Excellent, excellent. So, the awards luncheon will be held that Saturday of the NDA convention. We do have the incredible speaker, Dr. Uche Blackstock, which many of you have possibly heard of. She has been speaking all across the country on various topics that heavily weigh in on health equity. So we would love to have you all in the room for our luncheon that is coming up this summer. Our tickets online, they do stop their online sales on July the 1st, and we are actually on track for selling out. So please get your tickets right away tonight if you can. If you like to, you can take a screenshot of this slide and you can use that QR to get more information about the luncheon. And we're ready for next slide. Okay. And next, there we go. All right. So before we get started with the lecture for tonight, I did want to share some information about the CE and then one other important announcement. So for tonight, the CE is going to be 1 hour of CE that will be given to participants tonight. The NDA is a PACE approved provider. So the main way to get your CE and to make sure you can secure your CE is to complete the evaluation questionnaire at the very end of tonight's lecture. You should expect to receive your CE certificates within 72 business hours following today's lecture. If you do have any questions regarding your CE or certificates, please do not hesitate to contact the NDA, whether it be by email or by phone. And the other important announcement that we have today is that it is actually Dr. Bellamy's birthday. So happy birthday to you, Dr. Bellamy. Thank you for tuning in with us on your birthday. That makes tonight even more special. And ready for next slide. Thank you. So, without any further delay, I do want to briefly introduce to you our incredible speaker for tonight, Dr. Emma Guzman. If you don't know her, I'm sure a lot of you already do, but if you don't know her, Dr. Emma Guzman, she wears several hats. She is a dentist, she is a speaker, she is a fitness enthusiast, and she is also a society president for the NDA up in New York. Tonight, Dr. Emma Guzman will be presenting Wellness by Design, Oral Clues, and Whole Body Impact. And we'll be discussing the oral systemic connection in women's health. Without any further delay, I would like to bring Dr. Emma Guzman to the stage. Dr. Emma?
Thank you so much for having me. Thank you, Dr. Bellamy, for being here on your birthday. We were just chatting a few minutes ago, and I am excited to be with you guys today and to see all of you in person in Richmond. I hope to see all of you if you haven't registered yet. Scan the QR code, check your emails, check my story, check the NDA page, check all the things to make sure you register because we have a great lineup for you guys. And this is just going to be a little taste of what we're going to talk about in the conference and for future conventions. So let's get started. It's 8 o'clock. We don't want to keep you here all night. So, who am I and why am I speaking about wellness by design? Because I quit clinical dentistry. So, this happened in 2024. In 2024, I felt extremely heavy. I wasn't happy, even though I love what I do. I love seeing patients. I love dentistry. Dentistry was the only thing I've ever wanted to do. I decided in fourth grade to become a dentist. I was a dentist. I was making money. I'm doing all these amazing things, supposedly, but I was so unhappy. I was physically in pain daily and mentally I was not well. And one day I just quit. I gave my 2 week notice for my job and I told them, yeah, I'm not happy anymore. I'm not doing this. And it was a little crazy. I do not recommend just quitting your job without a plan. But I felt so unwell that I felt that was my only way out. And during that time, I was speaking to a lot of dentists. I was speaking to my mentors. I was traveling. I was finally taking care of myself. I was going to therapy. I was working out. I was doing all the things. And I'm like, wow, this is great, but it's not really sustainable. It's not sustainable to not work. So I had to figure out how can I have these happiness, sustain this life while still practicing dentistry. So not practicing lasted from May of 2024 and I didn't start working again until 2025. And still, in that sense, I was in academia. I wasn't in clinical dentistry yet because I'm like, okay, let me dip my toes back in and see how I feel, how I'm doing mentally, how I'm doing physically. And by April of 2025, I was back in the chair. I was back in the chair, feeling refreshed. And now it's been about a year since, oh yeah, it's been 2 years since I quit and a year since I've been back. And I've been able to maintain certain things with my lifestyle. And I feel like it's super important for us not to just think about what I'm going to speak about tonight when it comes to our patients and how we treat our patients, but mainly ourselves, because we are our main instrument that we use daily. So, what is our intention for tonight? To understand the oral systemic pathways and microbial imbalance, hormonal and whole body patterns reflected in oral health, wellness centered communication, preventative lifestyle guidance, and integrating oral systemic care into practice. So let's take a moment. Let's put down our phones. Let's close the other tabs. Let's stop doing the extra things that we could do when our cameras are off. And let's just take a moment and set our individual intention as to why we're here. Why did you register? Is it just to get your CE? That's okay as well. But take a moment to be present and fully be in this moment and know that we're going to learn a lot tonight. We're going to have some fun because I'm a silly person. And this is just the beginning of maybe a new mindset that we could take into practice tomorrow. My tooth hurts. Can you please just take it out? So I had a patient come in for a limited exam. It was not an established patient of the practice, never saw her before. And she wanted me to take out a tooth. She knew that that was going to be the solution to her problem. We did our diagnostics. I took a look at the tooth, and honestly, I didn't see anything wrong with it. But what I did see, and this was tooth number 14, what I did see was that the extraction sites for 15 and 16 looked relatively new. I was able to see in the x-ray that, okay, these teeth must have been taken out recently. So I started to inquire about that history. And she said, yeah, all my teeth bother me. I have sharp shooting pain. They can't find which tooth is bothering me. So she went to another dentist and she had 15 taken out maybe a month before she came to see me, and 16 was taken out 2 or 3 months before that. And I said, okay, I'm going to prescribe you some ibuprofen. And my recommendation to you is for you to go to your PCP and specifically ask for a neurologist referral. Why do I need to go to my doctor? My tooth hurts. Why are you sending me somewhere else? I said, because I don't think it's your tooth. You're getting all these different teeth taken out without a solution. I don't see anything wrong with the tooth. I think you may have trigeminal neuralgia, but me as a dentist, I cannot diagnose you with that. So I need you to go to your PCP, who's going to send you to the neurologist for you to get your diagnosis. She wasn't too happy with me, but she left and I didn't see her again. So maybe 2 or 3 weeks passed by, and the front desk tells me, Dr. Guzman, there's a patient in the front who wants to speak to you. And you're in the middle of procedure, you're in the middle of your day, you're like, speak to me, what's going on? There's a patient in the front who wants to speak to you. And it was the same lady. She came in and she was so thankful because she said, you were right. It wasn't my tooth. I do have trigeminal neuralgia, and now I'm starting to get treatment. And I tell this story to say that sometimes it's not the tooth. I didn't know a lot of us know that. There's people who may have pain because they have sinus issues, they have other things going on, and they think it's their teeth, and it may not be that. So we need to learn about how our system could affect our oral cavity and vice versa, because the majority of these things are bidirectional. So why wellness by design? Wellness by design is the intentional shaping of environments, habits, and clinical systems so that whole body health becomes the natural outcome, not an accidental one. We always should be looking at what is going on systemically, and it shouldn't be because this patient just happened to walk into the office that I'm at that she got the correct diagnosis. We want to make sure that people aren't losing several teeth before they get the correct diagnosis. So we need to make sure that our clinical systems are in place so that whole body wellness is something that's natural. So why women's wellness by design? Women, especially Black women, face disproportionate burdens of chronic disease, delayed diagnosis, and systemic barriers to care. And as dentists, we are frontline workers for early detection, prevention, and whole body wellness. And a lot of the times, oral findings could precede symptoms by months or even years. So, what's our role? We have to detect things early, intervene, and design this in our practice intentionally. So, let's understand the oral systemic pathways. So, how does inflammation affect our system? So, specifically by systemic markers, which include C reactive protein and interleukins. And what's going on now is when they're starting to test all these different systemic conditions, they're finding the same markers that come from periodontal pathogens. And it indicates that there's widespread inflammation that's starting from the inflammation in our mouth. And what else do we have to look upon? The oral microbiome. And we're talking a lot about this now and how the shifts happen and what is their role in disease. So, what is the oral microbiome? It's the body's first ecosystem. It's a diverse community of bacteria, fungi, viruses, and other microorganisms that live in the mouth. So, we're talking about our teeth, our gums, tongue, cheek, tonsils, saliva. And what does the ecosystem do? It regulates inflammation, it supports digestion, it protects against pathogens, it shapes our immune response, and it sends biochemical signals throughout the body. So it's how our body cells communicate with each other. And what happens if it doesn't function properly? It promotes harmful bacteria because the same way that it controls all those systems in our body, when we have more harmful bacteria, that's what is getting transmitted to the rest of our body. So when there's breakdown in our microbiome, it's a systemic impact. We start to lose the diversity because the pathogenic bacteria starts to overrun everything else. So we're talking about P. gingivalis, F. nucleatum, and T. denticola. So these are all the different pathogenic species that we learned in perio, those first few years of dental school that we're starting to see now that they're seeing it in the bloodstream and they're seeing it in our other organs. So dysbiosis is not random. It is a shift towards a pro-inflammatory disease amplifying ecosystem. So if the whole ecosystem is not well, it's just a domino effect. You have oral health disease, your blood pressure is not good, your blood sugar is not good. Everything builds off of each other. So when we think about the oral systemic connection, the mouth is the window to the rest of the body. So how are we seeing this in different systemic conditions? So periodontal pathogens increase cardiovascular risk by 20 to 30%. We're seeing periodontal proteins in various autoimmune conditions. We know that elevated cortisol is connected to systemic inflammation, which is also connected to sleep apnea and bruxism. Elevated cortisol has to do with stress, right? Which increases periodontal breakdown, xerostomia, and bruxism. We already know the connection between diabetes and periodontal disease, that's bidirectional. If you have periodontitis, it's going to worsen your glycemic control. And if you treat your gum disease, it can improve your A1C. Respiratory disease. Different acerated oral pathogens exacerbate patients that have COPD, and poor oral health makes those conditions worse. So, what is the landscape when it comes specifically to Black women? Black women have the highest rate of hypertension than any group in the United States, 60%. Black women are 3 to 4 times more likely to die from pregnancy related causes. Diabetes is about 13% in Black women, which is double than white women. And autoimmune disease occur 2 to 10 times more often in Black women. So there's already a higher chance of having an autoimmune disease if you're a woman, but if you're a Black woman, it significantly increases. So cardiometabolic diseases and oral health. Periodontal disease and cardiovascular disease share inflammatory pathways. So as I stated before, periodontal disease increases cardiovascular risk 20 to 30%. There's an acceleration in endothelial dysfunction and atherosclerosis. So those plaques that we're seeing with patients with high cholesterol, patients who have risk of stroke, they're seeing periodontal pathogens in those plaques. So how does that affect us? When 60% of Black women have hypertension, it's increasing our stroke risk, is decreasing the years that we're going to be on this earth, is decreasing the longevity of our careers. If we're not well, we're not able to function, we're not able to work, we're not able to see our patients. When it comes to our patients, how does this affect how we treat them? Are we checking blood pressure when we go into the office? Are we checking blood pressures before procedures? And if we are, when patients do have high blood pressure, what is our referral mechanism for those patients? Or are we just telling them, go to your PCP and get it checked out? Or are we actually following up with those patients? Diabetes and metabolic syndrome. We know this is bidirectional. Diabetics with periodontitis have 3 times worse glycemic control. Even if you don't directly have diabetes, even if you're pre-diabetic, it could lead to you having insulin resistance, which affects many other conditions, which also affects your blood pressure. And we know that periodontal treatment improves this. So this is what we have to talk about, especially when we're having patients that are coming in that may not want to do an SRP. They're saying, I came for a regular cleaning. Why can't I just get that? And I tell them, look, you see these, because now we have the AI in our systems. You see these orange boulders in your gums. Yeah, if I leave that in your mouth, if I just do a regular cleaning, because I'm not going under your gums, then that travels in your bloodstream. That could go to your heart. That could affect your diabetes. We need to make sure that the patients understand that is way more than just, oh, I have some tartar under my gums. Because when they can't see it and they don't feel it, a lot of the times people are not concerned. So we need to make sure that we emphasize the systemic aspect of this. And when it comes to Black women, they have the highest diabetes burden with women in the US. So autoimmune conditions and periodontal disease. Black women are 2 to 9 times more likely to develop lupus, and they have earlier and more severe disease. So the 5 conditions that are specifically connected to periodontal disease are rheumatoid arthritis, lupus, Sjogren's syndrome, which we know affects us in the dental chair already because these patients have xerostomia. So it increases their caries progression and mucosal breakdown. Crohn's disease and neuropathic disease. So what I was just talking about in my first story, trigeminal neuralgia and dysphagia. So this is the way that affects our oral health is because it affects the way that we treat these patients. A lot of the time, patients with trigeminal neuralgia are hesitant to seek treatment because they're scared that is going to cause a flare up. So I have a patient with trigeminal neuralgia. She had a few fillings for us to do. And I said, okay, what side do you usually get your symptoms? Okay, let's try one tooth on the opposite side and go from there. So we build that trust so the patients could come in and seek treatment regularly. So sleep disorders and the oral health connection. I don't have to harp too much on this. Obstructive sleep apnea, we already know that if our tongue is too far back, if our tonsils are too large, if the tongue is big, we're going to have some issues. So we need to make sure that we're directly referring patients to get sleep studies if they don't have a diagnosis and if we are suspicious that they have some type of sleep apnea. Bruxism. We live in New York City. For those who live in New York City, I feel like 70 to 80% of my patients have bruxism. I know the actual national number is about 40% of people suffer from bruxism, but in New York, everybody bruxes, and a lot of people are on anxiety medication, which makes it worse. So this is a part of something that we have to deal with daily, where I'm seeing young, very, very young patients that we're treatment planning full mouth rehabs just because they have worn down all their enamel. So we need to start to catch these things early, especially our pediatric dentists that are here. You know, when we're seeing things early on, airway issues, we need to start talking about treating these things early so it's less of a problem when patients grow older. So we have oral appliance therapy where we have to work together with an ENT, with their physicians to get them CPAP machines if that's what a patient needs. And when it comes to our sleep depth, dental professionals have the average sleep time of 6 hours, which is below optimal. If I get 6 hours of sleep, like that's normal for me. And what happens with this sleep debt is that it impairs our motor skills, our judgment, and error recovery. So now I think that because we're medical professionals and we went to dental school and we survived dental school, a lot of us are used to being functional and working really well with little sleep, but we need to make sure that we're recovering. Sleep is our time to recover. So we need to make sure that we're trying to sleep as much as we can. So my normal during the week is 6 hours. I will not lie to y'all. But over the weekend, I try to get my 7, 8 hours of sleep to make sure that I'm getting that recovery time. So now, how does this inflammation affect the system? All the ways that I just said. It lowers your risk of systemic disease when you have early intervention and prevention. But a lot of patients are unaware of the connection. They're asking us, why are we asking them their medical history? We ask them about their medication. They say none. And then we ask them if they have hypertension. They say, yeah, I'm taking the blue pill. So we need to make sure that we make it explicitly clear as to why we need to know what's going on. The mouth is the gateway to the rest of the body. The head is not separated from the rest of the body, and our patients need to understand that. So, stress physiology, chronic activation. So, sustained cortisol elevation suppresses our immune response, it dysregulates inflammation, and it impairs tissue repair. So, all of this starts from the hypothalamus, it goes to the pituitary gland, the adrenal gland, and it affects our immune system, and we get hormonal imbalance. So during our comprehensive health assessment, can I get some emoji responses? Who is actually asking about mental health when patients are coming in? Are we asking about the patient's mental health? Right? So I want to see some responses in the chat. Are we asking about mental health when they're coming in? Because stress is absolutely going to be linked to oral symptoms and how patients are able to take care of themselves. So, what's the weight of stress when it comes to Black women? Chronic stress from racism, sexism, and caregiving roles result in the weathering effect, which I'm going to talk about more a little later. Black women have a higher allostatic load score than any other demographic, and this includes Black men. Elevated cortisol is related to multiple oral conditions. And oral signs of stress are first visible in the dental chair. So we need to make sure that we're integrating stress screenings, sleep questions, and having specific referrals for our patients. So, what is the allostatic load? That is the cumulative wear and tear of the body from chronic stress. So, Black women have the highest load in the United States. The cumulative wear and tear on the body from chronic stress. So, what's the oral manifestations of stress? Grinding and clenching, which leads to wear, fracture, TMJ pain, headaches, heightened muscle tone, and reduced relaxation during sleep. That's probably why we're not getting more than 6 hours, right? I honestly, I did my sleep test. They said I do not have sleep apnea. I've done the therapy, I do the meditation, I do all the different things. I don't feel refreshed after sleep. I'm a chronic bruxer. I'm aware of that. I wear my night guard religiously, but there's certain things that's the way that I respond to stress, even if I don't subjectively feel stress. So if we're feeling that way, it's the same thing with our patients. Dry mouth, right? Reduction in salivary flow, right? That has a direct connection to increase in cavities, dry breath, infection. Patient describing cotton mouth, right? During high stress situation. I had a patient, now this is not xerostomia because he has a systemic issue. This is xerostomia from smoking marijuana. But I had a patient that was his chief complaint. He's like, how do I not have dry mouth after smoking? I'm like, stop smoking so much. One, no judgment here. But I'm like, you have to stay hydrated, right? Because it is something that affects your oral health. Canker sores and ulcers, this flare up during stress as well. There's people who know, oh, when I'm stressed out, I get an ulcer. And there's no direct connection to anything viral, bacterial, they have some trauma. No. When I'm stressed out, I get ulcers. And canker sores and ulcers are not comfortable. So that's something that you have to deal with every single time you're stressed. And with all the things going on in this world, that is not something fun that we have to deal with. So we have to make sure that we're controlling stress responses. Burning mouth syndrome, which increases during menopause, and behavioral shift. And this is when we have to really talk about mental health. Skip hygiene routines, patients who disappear for months at a time, sugar cravings, nail biting, emotional fatigue. All these different things are going to affect our oral health. So, oral inflammation is a whole body event. It is not something that's isolated to the mouth, and we have to treat it as such. We're the frontline systemic health providers. And I'm going to say it again, the mouth is the gateway to the rest of the body. The mouth is not separated from the rest of the body. So, what are the hormones that we have to deal with the shifts when it comes to the oral cavity? Estrogen, right? A lot of this changes when it comes to menopause because of different proliferation. We have mucosal proliferation, which is caused by estrogen, and that declines. So we get dry mouth, we get mucositis, there's resorption of the bone. With progesterone, this is mostly an issue when it comes to pregnant patients because it increases their risk of pregnancy gingivitis because it's higher when they're pregnant. Cortisol, we already spoke about that. Heightened cortisol when it comes to stress suppresses immune surveillance. So this is going to add to periodontal destruction, xerostomia, and candidiasis. Testosterone, It is protective when it comes to alveolar density. So when this declines with aging males, because I know we have some males in the building, right? You have an increased risk of periodontal disease and reduced osseous support. Your thyroid. When you have issues with your thyroid, you have delayed tooth eruption, microglossia, and pain, wound healing. Or you have hyperthyroidism with accelerated alveolar bone turnover or increased resorption. And insulin. Insulin resistance creates an inflammatory environment, and it's the same bidirectional relationship with diabetes. So, pregnancy and oral health. Black women are 3 to 4 times more likely to die from pregnancy related causes. Pregnancy gingivitis affects 60 to 70% of pregnant people. We already know about pyogenic granulomas, and this is something that affects pregnant patients and is more severe the second and third trimester. And untreated periodontitis is linked to preterm birth and low birth weight. So this bacteria is being transmitted from the mother to baby and is leading to low birth weight. Morning sickness can cause enamel erosion. So we need to make sure that we let our patients know and we partner with our GYNs. What is our referral network in our area to know that they need to seek oral care during their pregnancy? Radiographs are safe with proper shielding. They should be taking care of their periodontal health. They should be even more diligent with their periodontal health when they're pregnant. And they're able to take care of restorative and emergency needs when they're pregnant. We do not have to decline seeing our pregnant patients because they are worse off when we're leaving them in a worse oral condition. So, menopause and oral health. What happens with estrogen decline? Xerostomia, burning mouth syndrome, decrease in bone density, periodontal progression, and increased caries risk. Black women enter menopause earlier. Black women enter menopause earlier and experience more severe symptoms. So, what do we need to do in terms of how do we tailor our oral care? We need to make sure we know the products that provide salivary support for our patient. We have to do bone health screenings, and we have to collaborate with our PCP and GYN and letting them know that it's actually a part of menopause that there are going to be oral changes. How many times, and you can let me know in the chat, how many times have you had a patient say, oh, I turn X age and now all of a sudden my gums are sensitive. I turn X age and my teeth hurt. Why are my teeth looking so transparent? Why all of a sudden I'm starting to get cavities now and I never got them before? It's a direct hormonal connection with our oral cavity. So what is the weathering effect? So there's various stressors in our environment, and the stressors when we take that load, the wear and tear that comes to from racism, sexism, stress, underdiagnosis, unequal access to care, being told that we're being dramatic, being told that you must not really feel that, it must not hurt that bad, not being cared for properly, not giving the medication, not getting quick and efficient care increases our disease outcome. So that long-term stress start to make us systemically unwell. So how do we shift all these different things that we see with our patients? How do we take care of ourselves, right? Because the provider is the practice. We can't pour from an empty vessel And in dentistry, our body, our mind, and our spirit are the instruments of care. We're using our bodies physically to perform the dentistry. We're moving around. When it comes to our minds, it's not only doing the dentistry, it's also being the therapist for our patients. With every single patient, we have to think about what they're worried about, what hurts them, do they like the dentist, do they want to be here, all these different things that are going on. So we need to make sure that we are all those things for our patients, but are we taking care of ourselves in the same way that we take care of our patients? So we need to take care of our physical well-being, mental clarity. We need to make sure that we are well so we could treat our patient well and so that we could have sustainable practices. So when it comes to ergonomics, we are our most sophisticated instrument and we have to protect it. We need to ensure that our posture is good. I do not have good posture in my regular life. Okay, in my regular life, I am most comfortable slouching. But I have to learn and be aware that I need to sit up straight, especially when I'm working on patients. I have the habit to start to slouch into my chair, and I have to be aware I need to sit up straight. When you're sitting up straight, it's harder for your shoulders to live at your ears, which is where my shoulders like to live, right? Because there's tension here. So we need to make sure that we're watching our posture, where are we seated to have proper operator zone, magnification. Are we taking breaks in between our patients? Or are we just moving from room to room? And what are we doing outside of the practice? Are we doing strength and mobility training? So 76% of dentists report musculoskeletal pain. So we need to make sure that we lower this number so that we could have longer careers. Because having issues with our neck, our back, our wrists, our hands, all these things could shorten our career. So, what's the difference between burnout and just compassion fatigue? Emotional exhaustion, depersonalization is the biggest thing. Reduce personal accomplishment, right? It's a gradual onset. When this compassion fatigue is more so you have a bad day at work, something is happening, and suddenly you're just like, I don't want to do this anymore. But then the next day you're okay. That's not the same thing as burnout. Burnout is when you have a constant state of exhaustion and depersonalization. So you're no longer finding fulfillment in what you're doing, and the things that used to drive you are no longer driving you anymore. So we need to make sure that we recognize those signs so that we're able to deal with it early. So, our nutrition, we need to make sure that we're taking care of ourselves. I'm sorry, I'm going to say a really controversial statement. Coffee is not breakfast. It's not. Coffee is not breakfast, guys. We need to have protein in the morning to start our day. Okay, coffee is not breakfast. We need to make sure that we're feeding our bodies because it is our number one instrument. Are we having fatty acids? Are we having magnesium? Vitamin D, vitamin K, vitamin C, all the things that our people are supposed to have because we're not supposed to be in the cold weather. For the people who live in the Northeast, it was still cold last week. It's hot this week, so I'm not going to complain. But we have, and even if we don't have the natural sunlight, we need to make sure we're taking supplements so that our body could recover better. And we need to try to eliminate these ultra processed foods because even our whole foods are not really whole when it comes to this country. So, movement. Exercise is the most evidence based anti inflammatory intervention, and it is available to everyone. Are we stretching? Are we keeping ourselves mobile? Are we training? Strength training and aerobic exercise reduces our C reactive protein by 35%. So we need to make sure we're moving and keeping our bodies active so that when we do have that stressful day in the office, that cortisol doesn't override because we're used to having adrenaline. We're used to moving our bodies. So we don't want the cortisol to be the highest hormone that is in our ecosystem. So, how do we design a wellness centered practice? So, this comes to what are we doing for ourselves and for our team? What type of culture are we creating? Are we checking the schedule and making sure that we're able to take breaks? We're able to have lunch? Are we buffering time for schedules? Are we staggering patients so assistants could swap out? If we see the schedule looks a little crazy, are we rescheduling people? Are we asking another doctor to come in? Do we have comfortable chairs? Do our chairs work? Right? These are all the things we need to ask. Right? Are we doing wellness CEs? What type of CEs are we taking? Are we doing management and leadership CEs? Yes, we want to be clinically excellent, but what other systems are we setting up in our practice so it could be wellness centered? And how do we integrate them when it comes to ourself, our team, and our patients? So, how do we integrate an oral systemic screening system in our office? BP, it's it's more normalized for us to take BP, especially before extractions or any big procedure like that. But are we talking about our patient's glucose? Are we asking them their A1Cs? Are we asking them about sleep? Are we asking them about their stress? Do we know if they have any autoimmune conditions? Those need to be specific questions. When it comes to biomarkers, right? Bleeding, recession, ulcer, xerostomia, when we see those things in the mouth, are we trying to find the connection systemically and ask the patient, okay, I see some bleeding here. I take an intraoral photo. I show them. I put it on the big screen. What's going on here? Right? Because sometimes it's not just they don't floss, there's other things going on. And what's our referral pathways? Do we have direct referrals to our neighborhood PCP, cardiologists, rheumatologists, OBGYN, endocrinologists? Or are we just saying, go there? Or do we have someone directly to refer them to? I know specifically in New York, I have my network of Black everything. So I'm like, oh, you need a Black GYN? Here. You need a Black this? Here. You need a Black that? Here. And we're sending our patients directly to certain providers. Are we doing that in our practices? Right? And what are our protocols when it comes to hormonal changes? How are we making our patients feel comfortable to talk about the changes that they're experiencing with menopause? And the documentation and communication. That's how we build trust and adherence. We need to make sure that the whole team is standardized to ask these questions and it's not just the doctor. Because sometimes we're busy, we're running around and we can't get to everything, but we need to make sure that it's an integration of the whole practice. And how do we motivate our patients to talk to us more about this? And you ask them directly, how do you feel your oral health has been affecting your energy, your sleep, your wellness? They may not think about it like that. They may think about it as two separate things. Let them talk and listen for what their actual concerns are. What's their motivation? Is it I want to get healthy? Is it I want it to look better? Is it I want the most affordable option? And then sometimes when you connect the systemic aspect to the oral aspect, that's when they really understand how important it is. And that financial aspect is not as important. Positive reinforcements leads to 30 to 50% of improvement in oral hygiene behavior. So when the patients tell me, oh, I'm flossing once a week, doc, I'm like, that's great. That's better than most people. Most people are flossing no times a week. But how could we pump that up to 2 this week, 3 next week? Bring it up. So the next time you come in for your 6-month recall, you could say, I'm flossing 4 times a week, doc. Right? You never want to discourage your patient and you want to be realistic. I say, okay, what's better? String floss, water pick, this or that. What's going to make you floss? However you're going to do it, that's what I want you to do. So we want to be realistic with our patients and encourage them, right? Even if they're saying, I'm not flossing at all, like, you know what? Today's day one. Today is the day we're going to start flossing. And you always want to make sure that we're using that positive reinforcement. So I sped through that quickly, y'all. We need to become that safe space for our patients. And I'm just going to tell you a quick story that just happened. And then we could get to questions. Last week, I had a patient. She's undergoing radiation and immunotherapy for stage 3 breast cancer. She came in for an emergency, a limited exam. I just recently did a root canal and crown on her maybe 2 weeks ago. And I said, okay, see you at your 6-month recall. I don't want to see you again. Hope you're doing okay. She came in for an emergency. An onlay on number 1 came out. And I was like, damn, gotta put this thing back in. It's treatment plan for extraction, but because she's undergoing treatment right now, we left it there. So I said, okay, this should be fine. She wasn't having any sensitivity. So I'm like, I'm not going to numb you. I'm not going to do anything. I'm going to put this onlay back in and you can go about your day. She was complaining that she was tired, which is normal. Okay. She just had treatment a week ago. She gets treatment every 3 weeks. Week 2 is usually the worst week, which is why she always comes the week before she gets her infusions. She left. Everything was fine. Maybe 15 to 20 minutes later, I see the assistants from the corner of my eye bringing in a patient, walking in very slowly. And I'm like, no one's elderly is in the schedule. What's going on? And they said, oh, someone fainted. I'm thinking someone fainted in front of the office. This same patient left the office, went to a restaurant, ordered food, fainted at the restaurant, hit her head on the table, got a laceration, woke up, got her food, walked out the restaurant, and came back to the office. And she came back to the office because she was just like, I feel safe here. Now, that day ended up being very stressful for us because she was there and the EMS was there, paramedics was there. It was a several hour ordeal because she did come back to us, but I thought that was a beautiful thing that we are way more than dentists. And she felt safe to come back to the practice after she had a medical emergency. She ended up fainting again in the office. So it was a big thing, but become that safe space for our patient. It has to be more than teeth. We have to see them as whole beings. But the only way that we could do that is if we're taking care of ourselves the same way. So designing whole body health. Dentistry is a gateway to early detection and prevention. And Black women deserve equitable, culturally attuned whole body care. When we design wellness intentionally, we change outcomes and lives. And her saying that she felt safe was such a beautiful thing. And that's why I'm just like, that day I was like, I just did her onlay. Like, I didn't do anything. But that showed the impact that we make when we really care for our patients properly. Thank you. And yeah, you guys got a little snippet of how we could connect oral health with our systemic health and how it's not only about our patients, we have to focus on ourselves too. We have to take care of ourselves first, y'all. We have to take care of ourselves first so we don't burn out, so we have long, thriving, beautiful careers. Do you want to do the questions now or do you want to do the other slides first, Dr. Hare?
We can do the questions now.
Okay.
All right. So thank you for that insightful lecture, Dr. Guzman. You shared a lot of great statistics and tons of relevant information that can inform not only our practices, but our daily lives. So thank you for that information. For your questions as an audience, if you could please jot those down either in the chat or you can unmute yourselves and we can talk that way. I do already have some questions for you, Dr. Guzman. So, just
Right.
start off,
Stress, blessed, and coffee obsessed. I love that.
right? Was that Dr. Orpheus? So, I think, all right.
Robin.
So,
Yeah.
for our first question is regarding the team that we have in our dental offices.
Mhm.
As we all know, as docs, we are usually very busy, hopping from room to room.
Mhm.
How could we leverage our team members in order to optimize a wellness-centric office and practice?
First step to that is making sure that we practice what we preach, right? So we have to take care of our team members a certain way for them to even care about integrating it when it comes to our practice. So if they're overworked, stressed, burnt out, feel like they're going back to back and all these things, they're not going to really care about anything that we're trying to implement, right? So we need to make sure. So I'm in a busy practice. I work with Dr. Corte and Dr. Ellerscar in Brooklyn. And, there's sometimes where you feel like things are chaotic in the practice, right? You're jumping from room to room to room. But we can't really function properly if the team is not functioning with us properly. So we make sure that we have our we have wellness days with the practice, right? We go to the spa together. We have team fun activities. So every other month, we go and do something together. We do laser tag, we do karaoke. We make sure that we actually work as a team and hang out together. When it comes to someone coming into the practice and they don't feel well, we send them home. Right? We're like, you don't need to feel like you're forced to be here, right? Are we providing our team with PTO, with sick days? What does that look like? What does coverage look like for them? What does it look like if they have to work through lunch, right? Are we saying, okay, well, deal with it? Or are we making sure, no, now someone has to switch and you take your hour, right? We have to make sure that we're implementing those things so that when it comes to them saying to the patient, "Oh, are you taking care of your systemic health?" But I'm here stressed out with this slave driver. Like, no, you can't have that relationship and dynamic with your team if you're not practicing what you preach. So we're able to practice what we preach. We know we take care of the team. So we know that the team is going to take care of us and take care of the patients when they need to. Right? When I'm running behind, I'm not really, I know that they in there entertaining them. They doing something to make sure that they're good, right? Oh, doc, I already took the x-ray for you. Doc, I took the impression. Oh, I did the scan of the opposing arch. I did something, right? Oh, I took the blood pressure already. I started having them do the screening questions. I'm showing them the video about periodontal disease. You're doing something else to make sure that you have the team engaged. But if you have those toxic people, you have those people that you go into the practice, you don't want to see them, they're bringing down the energy, get rid of them. It's like a plague. Sometimes we don't want to, we don't like to because we're like, oh, but I need that extra hand, I need that extra body. It's worse to have that person in the practice for your own mental health, for your own sanity, but it's also not good for the rest of the team. So you need to make sure that when it comes to your team, you have people who want to be there. You also have to want to be there for the rest of your team to buy in.
And that's a great point, Dr. Guzman. We do have to want to be there um, and build a culture within the office by putting our foot forward and being that example, like you said.
Mm-hmm.
We do have another question from the chat, and that
Mm-hmm.
question is regarding skeptical patients. So,
Mm-hmm.
how would you approach a patient who may be skeptical about the oral systemic connection?
You the same way when it comes to just describing what we do in dentistry, we have to educate them We have to have pamphlets, we have to have videos, and specifically, we have a tab on our YouTube with all the same videos showing them the link of periodontal disease to heart disease and periodontal disease and diabetes and all these different things because sometimes they are skeptical. Oh, what does that have to do with the other? But when we tell them, no, this goes to your blood, right? It goes into your bloodstream. Or they'll come in, oh, I heard someone died from a toothache. Yeah, because it goes into your bloodstream. I said, so all of this bacteria that's sitting in your mouth, where do you think it's going to go? It has nowhere else to go but your bloodstream.
Mhm.
So we have to make sure that we're educating them. And at times, is everyone going to be excited and want to do it and want to answer certain questions and say, well, I don't care, doc. I still want the regular cleaning. You're not the patient for my practice.
Mhm. And thank you for sharing that. I know a
Mm-hmm.
lot of folks in the room probably have had to navigate the challenges of a patient initially not buying into the idea of
Mm-hmm.
the oral systemic connection. So being able to educate the patients, that sounds like a awesome tool to be able to create an environment within our offices where everybody is on the same page regarding the oral systemic connection. So,
These questions on the chat, I know.
right, right.
Why do we be ignoring perio?
Mhm. Yeah, so it looks like we have time for another question. We'll be wrapping up before 9:10.
Okay.
We'll start off with Dr. Forsyth. So Dr. Forsyth's question is, what role do you think academic institutions should play in increasing awareness of the unique stress burdens and health disparities affecting
Mm,
Black women, especially when these issues tend to be overlooked? A layered question there for you.
yeah. What role should they play? They need to have topics like this be discussed. And not because it's Black History Month, not because it's Women's History Month. They had to actually speak about these things and try to put an effort in implementation because it does start very early when it comes to the burdens because if we think about being a Black student in dental school and even if you're in, unless you're in an HBCU and some of the HBCU now is even shifting in terms of the demographic, just the burden of being a dental student. So when it comes to how do we deal with the stress burden, we have to start talking about it from then because it's only going to get, I don't want to say worse, but it's only going to increase as our career goes on. So I do think that there is a responsibility for the academic institution to add things either to their curriculum or if it's something that's a lunch and learn or something that's going on to talk about wellness, stress burden, and also the leadership and business aspect of dentistry more than the one class that we have to take.
Mhm.
Because a lot of that leadership, management, financial aspect of it is what's decreasing our wellness and increasing our stress. But we're taught teeth, deal with teeth. We're not taught everything else that we have to deal with when it comes to this profession.
Mhm. Yeah, so it sounds like what you recommend is truly integrating wellness talks and very more specific wellness talks when it comes to different demographics within our
Yes.
curriculums in school and really making it a part of our daily conversation as
Yeah.
well. When it comes to our schools as well. So, we do have one more question for the evening, and it comes from Dr. Leroy Horton, who is a periodontist. And the question is, why do you think so many general practitioners ignore perio?
Mm.
As a periodontist, I see a lot of patients with long-term neglected perio that say that I've been getting regular cleanings every 6 months. And now all of a
Mm-hmm.
sudden I have gum disease. So for the question for Dr. Guzman is, why do you think so many GPs ignore perio?
Um, our inherent lack of wanting to confront, and that's just a communication issue. And most people are non-confrontational. We don't want to be non-confront. We don't want to be confrontational. We think of confronting as something negative. We want people to like us. Well, they already don't want to be here. Now I have to tell them they need an SRP. Oh, they're gonna have it out of pocket. They weren't expecting to pay. Uh, would I rather get this payment for the pro fee versus the patient walking out? All these different things are swirling through our heads. And I think that what we need to do is just you set your protocol, and your protocol is your protocol. And that's it. You educate your patient, you tell them XYZ. And when it comes to how do you answer those questions, I, I can't tell you why the last dentist didn't do it. That's it. Can't tell you. I had a patient ask me, why do you care about my gum disease and that dentist didn't? Can't tell you why someone else didn't care. All I could tell you is what I'm seeing today and what I'm presenting to you today. And this is the treatment that I'm telling you. Now, when they're saying, well, I just want my regular cleaning, da da da, okay, how many people are succumbing to that, doing it? Okay, they'll come back for their SRP because, and then the patient had amnesia and act like the patient, like, you never spoke to them about the periodontal disease. That's a factor as well. But I have seen it, and I do know that there's a lot of hygienists out there that are doing bloody prophies, and you just have to stand by your protocol, and that's it. For me, if you need an SRP, you need an SRP.
Mhm.
That's it. I want a regular cleaning. Go somewhere else.
Mhm.
You
Yeah.
have to stand by your protocol because we need to know that we're taking care of the patient. I'm going to leave a bad review. Congratulations. You have to stand by your protocol because we have to stand by the health of our patient. We are supposed to be their advocate. So
Mhm.
if you know that you're doing the right thing, some people may come back, some people may not. But the people who don't, so what? That's not the patient for your practice. I I've had reviews that was, oh, I was really upset. They didn't see me because I had high blood pressure and da da da. But then I went to my doctor and I figured out I had XYZ. Thank you for not seeing me. People are gonna appreciate it. Some people still won't. Right? They'll go somewhere else, they'll get their bloody prophy, but then they want to come back to get treatment. And I'm like, you still need an SRP. I'm still not doing anything on you. You have to stand by your protocol. So why are people fearful? Because they don't want to confront.
Mhm.
People are
And
scary.
yeah, see, we got a heart from Dr. Horton, our periodontist, in the chat. And yeah, thank you for encouraging us to stick by our protocols. And we know at this point, especially by the end of your presentation, that hey, periodontal disease is linked to so much when it comes to the systemic health. You
It
listed several
is.
things. So those are some things that we can have in the back of our minds when we see a patient that does have signs of periodont periodontal disease. We could have those different systemic conditions in our minds, and maybe those are things that can further prompt us to say something about the periodontal disease and recommend treatments.
We
All
can't
right.
ignore it. Inflammation is the start of everything.
Mm.
We can't ignore it.
Absolutely. So thank you again for that insightful lecture, Dr. Guzman. We got several raving reviews in the chat here, and we also have an MD in the building as well that said thank you for not forgetting that
Yes.
you're also a physician and a physician of the mouth as well.
Yes.
So thank you for everyone who is here tonight. Just as a reminder, in order for you to secure your CE credits for tonight, you do have to complete the questionnaire that will be popping up at the conclusion of this webinar. And we'll go to our next slide. And again, I do want to invite you all not only to the overall convention that we have coming up this summer, with the NDA, but also the Women's Health Symposium Awards Luncheon, which will be on Saturday. You can take a screenshot of this slide, and we would love to have you in the building at the Saturday Awards Luncheon. So thank you again, everyone. I want to thank definitely our speaker, Dr. Emma Guzman, for sharing that incredible presentation with us. Thank you to my committee. I am always happy to work with you all, and thank you for our staff, our NDA staff. We have a couple of them in the room as well. And last but not least, thank you to all of you for attending tonight's session. I know we all are leaving with information that will not only help our patients and community
Mhm.
members, but also ourselves. So
Mhm.
please take hold, take grasp of this information that you learned today. And hey, you can apply it tonight as soon as possible, but certainly during your daily practice. It is about time for us to wrap up now. We're right on time. So,
Yes.
again, thank you all so much for being here. The questionnaire will pop up, and I hope you all have a great evening. I'll look forward to seeing you all this July. You have a great night.